and I have 6 kids. Well, I have 4 kids and 2 stepkids. Being a mom is really, really hard, probably the hardest job in the world. So I hope that by doing this, I can help other moms who might be struggling or be able to answer some questions by learning some things that I've learned through my motherhood journey. I also work for Intermountain Healthcare. I've worked for Intermountain almost 19 years in various roles. And I right now work for the Behavioral Health Clinical Program as a business operations coordinator. So I've learned a lot about mental health resources for kids. And I'm hoping to share a little bit about that because I think that there's a lot of folks out there struggling and they don't really know where to go for help. So hopefully this helps. One of my daughters has had a lot of mental health struggles, and it started when she was in high school. And the natural place to start for help was with her pediatrician. And I think most primary care physicians, like a pediatrician, can only do so much. And she needed a little bit more support. About the middle of her junior year was when she stopped going to school. So I was getting ready for work and getting her younger siblings ready for school and had to get them to school. And it's really, really hard to physically force a 16-year-old to get out of bed, to get dressed, and get in their car and drive to school, like virtually impossible, especially when you're trying to get younger siblings to school and then get to work on time. So it was when she stopped going to school that I got really worried and didn't really know how to help her. One thing I'm really good at is asking for help, almost pleading. And one day I told my work I was going to be late, and I ended up at school kind of desperate and went from the front office to a counselor or 2 or 3 and eventually ended up in one of the administrators' offices, probably crying. Basically just said, she won't come to school. Why isn't she on your radar? Like, why aren't you trying to help her more? But it's a big school, and she wasn't failing all of her classes. She was not on their radar at all. She was in the school play, and she would get up and go to rehearsal in the afternoon, but she wouldn't go to school. And I was not okay with that. In my mind, if you want to go do the fun thing, you've got to do the school thing too. So I went to the school for help and basically, in so many words, said, I need help. It takes a village. And I need reinforcement from the school to send her the message that you can't just do the fun stuff. You've got to do the school part of school as well. It turned out after we took her to therapy, she ended up being admitted into a psychiatric unit, and that was for a few days, almost a week. And then she ended up in a program called day treatment, which prior to that, I didn't really know what it was, but she was sick enough and needed enough help that she was a good candidate for day treatment, which at the time, and I think it still is, you unenroll your child in high school because they do school there. They do school in the morning and then therapy in the afternoon. And it's like an 8 to 5 Monday through Friday kind of deal. That was really good for her. She ended up having to go through that program again after a pretty serious suicide attempt the following summer. But I just can't say enough good things about the Wasatch Canyons campus. That's the behavioral health treatment through Primary Children's Hospital. And they have a whole separate campus out in Taylorsville, and they took really good care of her. And we learned a lot through going through their programs, and they focus on teaching the kids and teaching families. And it really made a difference in her life and in our family as a whole.
What is the best response when your child is sad, but they don't know why?
I think I've learned as my kids have gotten older and dealt with anxiety and depression, and identifying their feelings when they're sad is to, number one, normalize the feeling and then to validate it. And I've told my kids, it's okay. Sometimes we're sad and we don't know why. And being sad is part of life, just like being happy is. And it's not wrong or bad to feel discomfort. It's normal and it's part of life, and it won't last. And feel it, own it. If it does last, I guess then that's when maybe you have a different problem if the sadness doesn't ever go away. But feel sad is part of life, and it's okay to not know why and not have a reason, and you don't have to feel bad about that. I've learned to not ask, are you okay? That's not a good question to ask, and I was guilty of that. So I learned through my daughter's therapy to ask, how are you feeling? And that is such a simple change, but it has made a world of difference. And I use it not just with my kids now, like my siblings. I think if I'm trying to help a friend, how are you feeling? Number one, it's not a yes, no question. And number two, it kind of forces or prompts somebody to really think about, what am I feeling? How am I feeling? And everybody has different levels of the ability to identify what they're feeling. Some of us are really good at it, and it takes some time. What am I feeling and why? I'm feeling sad, feeling hungry, feeling anxious, feeling mad. So for the question about how do I help identify, I love that question. Like, what are you feeling? How are you feeling? I love that one.